The federal government has gutted Navigator funding. This is the second time in 2 years this has happened. It came in a July 10th press release that points to an 80% reduction in funding for Navigators, the assisters meant to help people navigate enrollment in the marketplace in the open enrollment and special enrollment periods moving forward over the last 2 years. We went from about $63 million being appropriated across the 50 states to 36, there, give or take, and now we're down to just $10 million for all 50 states to share unequally, and we'll talk about that in a second, for the next open enrollment period. This is on top of the April 9th announcement where the Department of Health and Human Services announced they were going to remove some of the rules that dictated how many Navigator entities were in each state, and remove specifically the physical presence standard that you had to have in-person assistance available in your state. It's been a chipping away at the assistance provided to get people to the Affordable Care Act's marketplace. Some are calling this just another attempt to chip away at the Affordable Care Act itself. In addition to reducing the amount of money available for in-person assistance, there are new requirements added that navigators that are funded will have to inform consumers about junk insurance, short-term insurance and association health plans for the first time. And these are the plans that come without the protections of the Affordable Care Act. Things that prohibit discriminating against people with pre-existing conditions, for example, and excluding types of coverage like maternity and newborn screening. That's now part of the duties of a federally funded navigator. This is all part of a request for proposals that are due August 9th. States, like we said, will be competing for $10 million total. The number is loosely appropriated based on your uninsurance population in your state. Some states are competing for only up to $100,000. States like Wisconsin are targeting more in the $200,000 range. States like Texas, with a very large uninsured population, will actually be competing for over $1 million. Like we said, this is down from $63 million just 2 years ago, and even that was deemed not sufficient to provide the level of in-person assistance individuals need to determine what their best health care coverage options are moving forward. CMS is also, as they have been for the last several years, urging people to use agents and brokers instead of navigators. Now, agents and brokers will have expertise in particular private insurance plans. They won't necessarily have expertise in other programs such as Medicaid, Medicare, and trying to get people into the best coverage option. Something to watch for as we go into open enrollment for 2019. The impact, it's left to be determined. There were about 11.8 million people enrolled in federal and state marketplaces in 2018, despite that last round of cuts. That's down just a little from the 12.2 million people enrolled in 2017. What will it mean when navigators are working with that much less money than the last time around? That has yet to be determined. Less people get served? Potentially, especially in the hard-to-reach rural areas. The CMS press release, like we said, points to agents and brokers as being a solution. As you know, if you're in a rural area like northwest rural Wisconsin, not a lot of agents and brokers taking on enrollment in marketplace plans. So that's where navigators can fill in the gap, where there are hard-to-reach areas. Seema Verma, the head of CMS, said it's time for the Navigator program to evolve. That she was met with some criticism of that quite quickly, saying this is looking more like federally funded fraud by pushing people into junk insurance plans instead of helping them comprehensively get affordable, comprehensive insurance. You can read the press release from CMS yourself. You can read the RFP for funding. You will go into the grants.gov and search for the CFDA number to get right to that RFP. You can send us your questions or comments. Have you been helped by a navigator? What would it mean to you if navigators were less available going into open enrollment for 2019 plans? You can send us your questions, and you can do that at healthwatchwisconsin.org.